Hi everyone. We had the opportunity to meet Mr. John Thomas last year on the 15th of January 2025. So, to help improve his overall well being, I would like to just review the case once again with everyone here in the interprofessional team present and discuss what I will do for him as his GP or physician. So, let's summarize the case. Mr. John Thomas came to ask for help in regards to a lot of communication barriers that he's experiencing in daily life, and this is causing poor work performance and social isolation. Currently, he is not retired. He works in IT, and at work, he mentions that he is not able to move around much as he's stuck behind the telephone most of the day, providing support for his customers. Significant weight gain has become one of his main concerns from his lifestyle. For his medical history, Mr. John Thomas is a 65-year-old gentleman with hypertension, type 2 diabetes, depression, bilateral tinnitus secondary to the diagnosis of his depression, congenital Waardenburg syndrome type 2, and bilateral sensorineural hearing loss. He does have a family history of hypertension and type 2 diabetes. Now, Mr. Thomas was unable to list his medications completely, but he's currently on Wellbutrin, the dose is unknown, and several unlisted antihypertensives and antidiabetic medications, which are working effectively. We're going to emphasize patient centered care by using the biopsychosocial model. Our interprofessional collaboration will produce health outcomes that will try to tackle problems from each branch of this model. They are all interconnected, and not being able to address what we need to do in one area is going to affect another. So, as you will notice in the next couple of slides, some issues may occur in one branch and bring another problem in another. Starting off with the biological. These are usually the most problematic factors or chronic conditions that exist, which stand out and have the greatest risk to the health of Mr. Thomas. We want to first address his cardiovascular health. Mr. Thomas has metabolic syndrome, which currently puts him at a higher risk in developing cardiovascular diseases and cancers, such as colorectal and liver cancer. The World Health Organization claims that 32% of global deaths are from cardiovascular disease, and 85% of that is due to heart attack and stroke. Fortunately, his hypertension and diabetes are being managed well through medications. However, he will definitely benefit in a change in lifestyle. Next is Waardenburg syndrome. Although it does not pose a greater risk than cardiovascular disease, this is a condition that Mr. Thomas was born with, and it has a lot of issues associated with it, such as hearing loss and impacted vision. This is all affecting his self esteem, which we will talk about more in the later slides. And last, we have medication management. Medications provide benefits, but they are also associated with a lot of risks and adverse effects. So, if we put on Mr. Thomas on a bunch of pharmacological interventions, we can increase or worsen the issues that he already has. So, we have to keep an eye on everything. For example, in this case, we have ototoxicity, which may come up when we use diuretics as antihypertensives, and some antidepressants also have adverse effects of ototoxicity. So, in terms of psychological factors affecting Mr. Thomas, depression seems to be the most prominent. He's experiencing a lot of frustration at work, and because of his communication barriers, he's been withdrawing from social interactions, which further exacerbates his symptoms. He has constant ringing in his ears, in addition to a degree of hearing loss, which are both contributing to his depression. It is important to note that untreated hearing loss is not only worsening his symptoms, but may actually accelerate cognitive decline if we do not address this. In terms of tinnitus, there's a lot of mental health factors that individuals feel when they experience tinnitus, such as stress, anxiety, fatigue, irritability, insomnia, and exhaustion. And we have the last branch, which are social factors. And here we are not only looking at Mr. Thomas himself, but we are also taking a look at the environment he frequents. We can see that hearing plays a significant role in Mr. Thomas' social life and occupation. His hearing loss is affecting his performance and job satisfaction. With vision and hearing impairments, he has decreased awareness to his surroundings, which is definitely going to pose an increased risk in safety. As the physician, I'm the primary care provider for Mr. Thomas, which means that I should be able to guide and provide any information he needs. In the next slide, I will be talking about my responsibilities as his physician. I will coordinate and monitor the care from all points of contact, making sure that information from all the members of the interprofessional team are set into a proper care plan. I'm going to be managing Mr. Thomas' conditions as a whole and not work symptom to symptom. This means taking into consideration all the factors we just talked about and are involved in the biopsychosocial model. I will be recommending an order for his treatments so we can prioritize the most urgent problems first and make sure nothing is missed out. Ultimately, I want to prevent further risk and functional decline for this patient by improving his independence and quality of life. As a physician, my responsibilities include routine medical assessments like conducting physical exams and documenting vital signs such as blood pressure and heart rate. Medications and treatments will be prescribed according to my body of knowledge, along with the latest blood tests and diagnostic scans available from Mr. Thomas. Highlighting his safety, I will monitor medications closely and keep an eye for adverse effects. I will provide patient education and make referrals to other clinicians when it goes beyond my scope of practice. I will coordinate with the team so we can address his health issues effectively. We can use the biopsychosocial model to help with the decision making to make sure that we are not only just treating a disease, we are prioritizing treatments and supporting each other in the interprofessional team. From my perspective as the physician, I recommend that we start by managing the biological factors, with cardiovascular health being a priority. This can progress into life threatening conditions, which we aim to avoid. Physical therapy and a dietitian will be able to help control his weight and blood sugar levels through exercise and diet changes. I will work with the pharmacist to review all of his medications. Then let's take Mr. Thomas' mental health in consideration. Here we can aim to manage his depression, tinnitus, and treat his hearing loss with hearing aids. Referrals will be made to a psychologist and a hearing practitioner. In terms of social factors, we want to improve his safety and quality of life. I will be referring Mr. Thomas to occupational therapy to see where we can help him at work. An optometrist will also be able to help in providing treatment for his impacted vision and discuss the UV risks associated with his Waardenburg syndrome. So, here are a few questions I'd like to bring to the table for discussion in our interprofessional team. This question is directed to physical therapy. Are there any activities or exercises available that we can include in the treatment plan for Mr. Thomas and his tinnitus? For optometrist, what can we do in the situation where Mr. Thomas develops diabetic retinopathy? And lastly, for the pharmacist, what possible alternatives to Wellbutrin or bupropion might be available for Mr. Thomas, considering the adverse effects such as ototoxicity and tinnitus?